Introduction to Pharmacology and Toxicology. That definition of pharmacy. Pharmacy, it is the branch that deals with preparation of drugs and drug combination in suitable dosage form, suitable and convenient for the administration. Then the definition for the disease. Disease is defined as a particular abnormal condition that negatively affects the structure or function of part or all of an organism and that is not due to any external injury. Then definition of pharmacology. The word pharmacology is derived from two Greek words, that is the pharmakon and logos. The meaning of pharmakon is a drug and logos means treat or science. Definition: the pharmacology deals with study of sources of drug, mechanism of action, toxicity, absorption, distribution, and metabolism of drugs. The definition of drug. Drug is derived from French word drogue meaning dry herb. Drug is defined as any substance used for diagnosis, prevention, and treatment of diseases. Then toxicology. It is a science which deals with adverse effects of the drugs and study of poisons. Pharmacokinetics. It is the study of absorption, distribution, metabolism, and excretion of drugs, their relationship to pharmacological response. That is the what the body does to the drug, means the pharmacokinetics. Then pharmacodynamics. The quantitative study of biological and therapeutic effects of drugs and their mechanisms of action is called as the pharmacodynamics. That is the what the drug does to the body is known as the pharmacodynamics. Then pharmacotherapeutics. It is the deals with the application of drugs in the prevention and treatment of the diseases. It means the various methods and systems that are used in prevention and treatment of the diseases. Clinical pharmacology. It is the scientific study of the drug in man. It is include pharmacodynamic and pharmacokinetic investigation in healthy volunteers and in patients. Analysis of cost benefit and risk benefit ratio, determination of ideal doses, and drug utilization patterns are also the part of clinical pharmacology. Then pharmacogenetic. It deals with the variation of drug response due to genetic factors. Variation in drug response may be affected by genetic variation. It is also called as the idiosyncratic reaction or drugs or inborn error of drug metabolism. The genetic makeup of an individual is responsible for variation in the drug effect as well as toxicity of drugs. Next, bioavailability. Bioavailability, it is defined as the fraction or amount of drug that reaches the systemic circulation in an unchanged form and is available at the site of drug action is called as the bioavailability. Prototype drugs. All the drugs used in medicine can be arranged in about 70 major groups and each group contains several drugs. In each group of drugs, one member which exhibits the major actions of all the drugs of a group is called as the prototype drug of the group. Gene therapy. Gene therapy is defined as to modifying, correcting, or replacing an inherited or acquired deficient gene that is responsible for the diseases. Next, xenobiotics. Xenobiotics is the chemicals foreign to the body which can produce physiological or pharmacological effects are called as the xenobiotics. Next, orphan drugs. These are the drugs for rare diseases and that affect only a small number of people. These drugs also not easily available commercially as due to their limited sales, their cost of development and manufacturing is not profitable. The government usually provides some help in the development of such a drug. For example, acetyl-1-cysteine used for the paracetamol poisoning. Next, 4-methyl-pyrazole used for the methanol poisonings. Then, branded versus the generic drug. The active constituent from both brand name and generic drug are the same. The price for the generic drugs is lower